Hello everyone and welcome to another week of our NPTEL course in Herbal Drug Technology. This week we are dwelling into a very interesting set of topic, and that's your herbal formulations. Herbal formulations have become inevitable part of our life, so much so that in the morning, starting from your toothpaste to your hair oils to the products that you take, antacids, many of them, even your health supplements, juices and the foods that you've been taking have been fortified or even modified to become nutraceutical ingredients as well as herbals. So herbals have found their way into different formulations that we consume or use on day-to-day basis. So this week we are going to do a little more deep thought and gain knowledge into what exactly are herbal formulations. So just to define, herbal formulations are products. So these products are well to use products which have an intention, or well to use products which contain one or more herbs. Now these herbs may be in their native form, just like as such in their powdered form, or they might be processed. So these herbs may be raw or they may be dried. In some cases, herbal products such as essential oils or extracts are also used. So you can have a product made up of single herb or a polyherb. It can be processed, it can be as such, it can be dried, it can be fresh. In any form it is used, it will still be categorized as herbal formulation as long as it is converted into a product. Now this product should have specified quantities, or to be precise, specific dose of ingredients. We call it as bioactives. Now these bioactives are going to give us specific nutritional requirements, therapeutic benefits as well as cosmetic benefits. So herbal formulations encompass a very broader area which can give us nutritional, therapeutic as well as cosmetic benefits, intended most often to diagnose, treat, mitigate or even alter the structure or physiology of humans and animals. Now this definition in verbatim allays very much with the Drugs and Cosmetics Act's formulation of your drugs. Now herbal formulations, why do you need to formulate? So if you are advised to take a kadha, or if you are advised to eat a herb as such, now there are certain herbs which might be intensively bitter. Some of them have a very obnoxious odor, some of them are very acrid, bitter, intolerant, and color wise they are most often dark, and that makes it a little impalatable and unapproachable. And to make it more user friendly, what we do is we convert them into products which the consumer likes, and that's the need when all your excipients or the formulation traits are brought in and your herbal powder is converted into a herbal product which you can easily use for your therapeutic, cosmetics or even nutraceutical benefits. So these herbal formulations can be classified based on their dosage forms or based on their forms as solids. So you can take your herb, convert or pulverize, size reduce it into fine powder, and this powder you can use it as your solid, or this herb you can extract it with one particular solvent, like you prepare your teas, we call it as decoction or extraction, and then you can evaporate the solvent. So once the solvent evaporates, you get a solid at hand, and that is much more concentrated than your native herb powder, because most of the cellulosic matter which is present in your herb is now gotten rid of. So you are having more of your active concentrates, and this concentrates can be taken again as dried powder. When you subject this extracts to spray drying, freeze drying or other drying techniques where your solvent is evaporated, you just have your solids at hand. So they could be solids in form of powder, they could be solids in form of what you call it as granules. You get them in those sachets like your vitamin D granules. Similarly, you get those herbal granules. You can even have tablets, capsules, lozenges, powders, dusting powders. They all are categorized as your solid formulations. The next category is liquid formulations. So liquid formulations are often the pourable formulations. So these formulations often, in order to make them more palatable, contain sugar or sweeteners, because liquids, if you take your plant extracts, they will impart their unique taste to the formulation. In some cases it is desirable, say for example your adulsa syrup or your tulsi syrup or even your black pepper in a very mild dose in a good combination with ginger and turmeric, they are all acceptable and we accept that flavor. But imagine something as bitter as your cinchona, or imagine quinine. In that case it becomes very unpalatable for the patient. So in order to mask the taste, certain taste masking ingredients, flavors or certain excipients, even sugars need to be added in order to enhance its palatability. Now this is not the problem with solids, because solids you can just coat it, or solids you can just fill it inside the capsule and the flavor and other attributes are kind of masked, even the aroma of it. Whereas in liquid, because it is in the solution form, your directly tongue is coming in contact with the formulation, and as a result whatever the flavor is of that herb is imparted unless and until you mask it. Not only that, with liquids one more limitation is when you see stability of compounds. We have done different phytochemical compounds. So when we are seeing stability of compounds, you know that compounds are most stable in solid form. When they are there in liquid form, especially your carbohydrates, when they are in the solution form with water, they tend to attract more microbes. So they are more prone to microbial contamination unless and until you add preservatives to save it from microbial contamination. At the same time, the rate of reaction, the rate of deterioration of the actives is much higher in liquids as compared to solids. But yes, they are also the dosage forms which are easily assimilated. Now because they are in the solution form, the bioactive is already dissolved. So you just need to drink it and your bioavailability is much more or quicker as compared to your solid dosage form, wherein it will wait or there will be some lag wherein your compounds will dissolve in the biological fluids. The third category of herbal formulations are semi-solids. Now semi-solids achieve a consistency somewhere between your solids and liquids, and we often encounter such formulations in form of creams. Definitely many of them find their applications in topicals. So when you are applying your Vico turmeric cream, that's a semi-solid. Or nowadays if you see your elderly parents, they are very addicted to those balms. So those ointments we call it, they contain number of active ingredients. Say for example your Vicks Vapor, they contain your active ingredients, and those balms are in the semi-solid forms. Not only that, your toothpastes are also in the semi-solid or categorized as semi-solid formulations. The fourth category, this is little smaller when it comes to the market volume, and those are aerosols, often herbal mist, sprays. Now some sprays can be as simple as your insect repellent sprays, or some sprays are merely cosmetic like your sunscreen, suntan or even freshness mist. You can also classify your herbals based on the different routes of administration. This routes of administration includes your enteric route, that is your oral route. Now again, going by the volume of medications, formulations or products here, oral is most common. The reason is oral route doesn't require your product to be sterile. Definitely when we consume it, the microbial load here in this products need to be controlled for safe usage, but sterility is not a criteria, so that manufacturing conditions are not as stringent. So orals formulations that we consume are your oral powders. Say for example your Triphala Churna or Shatavari powder, Ashwagandha powder. Many powders we just consume it. We have previously discussed churnams as ultra fine powders which often are administered. while chewing so that their bioavailability of the compound increases. We also have granules of drugs such as shatavari in the market, which are much coarser as compared to your powders and definitely a little retardant when your bioavailability of actives is concerned, but this is granulation is generally done for flavor masking or taste masking attributes. Granulation is also being done for sustained release or modified release formulations. In some cases where the herbal ingredients are very obnoxious, oddly colored and very hygroscopic, it makes more sense to encase them in capsules, and that's the next formulation. So for such ingredients, they are put it into your gelatin capsules in case of solids, or even soft gel capsules in case where there are oils. Nowadays you also get granules and oils combinations, especially in the nutraceutical category. Then you go to liquids, you have your solutions, suspensions, emulsions, oral sprays, as well as in solids you also have now mouth dissolving films or mouth dissolving barrier or mouth dissolving films, which are used to disperse or as mouth freshening ingredients as well as antibacterial. It can also be modified for the needs such as your sore throat or even mouth ulcers. In cases of topical application, now this is the most externally applied formulation. So topical are generally applied to your skin. This include your skin creams or Ayurvedic creams, gels. Nowadays people want more clarity in terms of ingredients, and gels often are associated with a cleaner look because they want a minimalistic approach as a product. In that case you will have your formulations often administered as gel, wherein a carbohydrate based polymer is used to make a jelly, and in that your herbal extract is incorporated. Topical films are also applied especially for wounds, blisters. You have plasters, you have oils which include your body oils as well as hair oils, serums, face serums, hair serums, as well as shampoo, conditioner products. Now you would see that in terms of the usage, earlier synthetic market still had a good hold. Nowadays people are looking for more sustainable, skin friendly, biodegradable, non carcinogenic ingredients. In that case, especially your herbal formulations gain a little added advantage and consumer trust. That is why people are bending more towards herbal formulations here. Now in this, the next category is inhalations. Again this is a minor market, but you will see in your market numerous tiny aerosols, inhalers as well as vaporizers. The fourth route is the one in which the preparations or your formulations need to be sterile, and that is your parenteral route. Now this parenteral route includes like micro injections in form of a transdermal injection, or depending upon the site it might be an intramuscular injection, or what we call it as intramuscular depot, or in some cases even subcutaneous injections. Some cases even drips such as IV drips have been administered which contains actives. Especially in this case, a due care is taken that whenever you are formulating a parenteral, it cannot be a herbal extract. The reason being, herbal extract is a mixture of bioactives, and previously we have studied that when you are dealing with phytoconstituents, now phytoconstituents belong to different categories. Now when you are thinking about parenteral route, you need to take into consideration polyphenolic compounds, especially tannins, as well as compounds such as saponins. Now tannins have a ability to precipitate proteins. Now imagine in your blood you have your albumin, globulin, you have your hemoglobin. There are numerous proteins to which your bioactives will bind. They will precipitate and they might render them inactive. It might lead to a lot of biological reaction. Similarly, saponins are known to cause hemolysis. So if you are injecting plant extracts, there is a good chance that you will also encounter tannins or some amount of saponins in the process, and that may cause your protein precipitation, hemolysis, and that may lead to adverse reaction. So in that cases, it is recommended that whatever is the active ingredient of that herb, say from Rauwolfia serpentina, it is reserpine, say from Digitalis lanata, we want digoxin. So purified digoxin, purified reserpine are the molecules which are specifically used for parenteral injections and not the extracts. One more care need to be taken is whenever you have to parenteral administration, sterility is utmost important. Now you can also classify your herbal formulations based on whether they are single herb, that is just one herb in formulation base such as powder, say for example ashwagandha powder, shatavari powder or gugul powder. Gugul you also get in form of tablets and capsules when they are mixed with other ingredients such as your excipients. So generally single herb preparation consists of a single herb with other excipients. Excipients are the inert ingredients not known to have any biological activity. So one active mixed with excipients, we call it as single herb preparations, or it might be a mixture of ingredients. This mixture of ingredients we have studied previously, Ayurvedic formulations. A few examples of a polyherbal formulations include your Triphala Churna, Dashmula Rishta, Navratna Tel. So Triphala is like 3 fruits, Dashmula Rishta is Dash means 10 root, and then you prepare a Rishta based formulation, that is your Ayurvedic formulation. Navratna Tel consists of 9 herbs which contribute their bioactives in a lipophilic solvent, that is your sesame oil. Now there are certain advantages of herbal formulation, and that is the reason we are studying in a herbal drug technology. The first reason is consumer psych. Now consumer psych is, like I said, as compared to allopathic ingredients, people are aware that herbals are much safer, cause less untoward effect, and are really good when used on long term. They may not give you immediate relief in many of the cases, but they can help manage your condition much better. Now that's the major reason or the psych, but with that you have to see that once you have a plant, you cannot administer a plant to a patient. Now say for example when you are discussing a herb such as Vasaka, and say the active is vasicine. Now in order to get a desired therapeutic effect, I need to give at least what is called as the minimum dose of vasicine, enough to elicit the effect. Now once I know the dose of vasicine, I can standardize my preparation so that every time the patient has 5 ml of Adulsa syrup, he has a specific amount of vasicine being consumed, and that is going to be therapeutically active. So it is often advised to use standardized extracts for the preparation of herbal formulations, and once you use standardized extracts with a very accurate actives level, you can get accurate dosing, and that ensures consistency as well as efficacy of your formulation. The next advantage of formulating herbs is taste masking. So we discussed, maybe once you've eaten your Karela, that is your bitter melon, or if you consume herbs such as neem, kalmeg, or even your swarshia, you will see that these herbs are extensively bitter, and in some cases or in some patients they elicit the feeling of vomitus, and they are not kids friendly at all. So kids are very deterrent by, or kids are often deterred by bitter tasting medication, and as a result once you formulate it, formulation can definitely be taste mask. So I can simply mask it by filling the whole bitter melon or Karela powder in a capsule, or I can punch it into tablet and coat it with a sweet coating like your gems or your sugar candy coating, or a sucrose based coating, or even a polymer based coating, so that your tongue never comes in contact with the actives and that bitterness is never felt. Now next advantage is herbs. If you just keep them in their native form over a period of time, because of the moisture content, they are prone to infestations. Now this infestations can be from the microorganisms to fungus to even bigger rodents, which are often attracted toward more sweet tasting medications. So in that case, as compared to giving your herbs which are often contaminated, if you clean it, extract it, convert it into concentrates, this concentrates can be stored well, and this concentrates can be used for preparation of medications. Not only that, as compared to transporting a ton of your herb, say for example senna, you can have a senna extract which contains 60% senosides, and that standardized extract is much easier for me to transport as compared to the leaf, which might increase much of the bulk. Not only that, when you convert it into a formulation, often the shelf life of the preparation increases. So whenever you are storing a herb, imagine like most of your kitchen ingredients are herb, and all your herbs, depending upon their moisture content, they have a shelf life. So starting from your tomatoes to your fruits such as bananas, they have a very short half life or a short shelf life of about 5 to 7 days. Imagine many such herbs also are included in your medications. If you want to store it, it would hardly be having a shelf life of few days. Now as opposite to it, if you prepare an extract of it, if you prepare a tablet of it, you know that nowadays you get spray dried tomato powder. So if you convert your extracts into those spray dried extracts or freeze dried extracts or powders, it is much easier to seal them, handle them, as well as transport them. But not only that, your conversion of this herbs into powders is going to increase your shelf life. So tomato per se might have a shelf life of 8 to 10 days, but the tomato powders, now you know that those go into your ready to cook soups and a lot of other preparation. So once you convert it into powders, the microbial or the deterioration is much lesser and the shelf life increases. The last is cost effectiveness. Now this is more important as economics play a very vital role in the herbal drug industry. Now herbs, depending upon their sources, depending upon the geography, you will see there is a good distribution, and India has a good geographical variation. So in our market, we have different herbs being available readily, and as a result, if you see herbal market, herbal medications are much affordable. They are cheaper in fact in some cases, and as a result for patients with economic constraints, they become a more cost effective options. So they can be made available under different geographical conditions, we just have to transport it, but they are much cheaper. Imagine your ginger, turmeric, they are cheaper, so they can be boiled to prepare kadhas, extracts, and just putting them into your tablet would hardly cost a thing. So comparatively to your allopathic medications, you will see that your herbal preparations or herbal medications are much cheaper. But yes, with recent technologies, updates where your nano formulations, more advanced excipients have been incorporated, definitely that's also a lucrative field where people are gaining a good margin, taking advantage of an still much unregulated market as far as herbal formulations are concerned. Now coming to the problems associated with herbal formulations. Now as a formulator, when I am taking a herbal ingredient with me, there are a lot of problems I would face while formulating it. Now these problems include your moisture content. So whatever you harvest from nature is laden with moisture. So whatever you're harvesting from nature contains water, and this water, like I said, attracts microbes. Not only that, if you see your fruits, initially when the fruits are very raw, they tend to be little stiff and turgid, but as they ripen they become soft, flaccid and more difficult to manage. Over a period of time they will start deteriorating and decaying if it is subjected to microbial infestation. And in all this process your moisture plays a very vital role. So immediately after harvesting, if you are able to control the moisture, especially you will see that in case of digitalis, the moisture content is kept below 5% to prevent the deterioration of cardioglycosides. But in some cases like your carbohydrates, acacia tragacan, the sugars tend to imbibe moisture from the air very quickly. So even if you dry it, they will be more hygroscopic, and that is the case even for your freeze dried powders. So freeze drying may render it completely free of moisture, but the moment you expose it, they immediately imbibe that lost moisture and become more soggy. So moisture content is a problem, and definitely once the powder becomes soggy, it becomes difficult to formulate. It is very simple to formulate a free flowing powder into a tablet rather than a clumpy and a slow flowing powder. The next problem associated is often related to adulteration. Now herbs, when you purchase them in the native form or when you have access to the cultivation of it, you can get a genuine herb. But because of geographical variations, because of synonyms, like one Brahmi being your Centella asiatica, other Brahmi being your Bacopa moneri. So locally or colloquially some of the herbs have similar or same names, and that creates an cases of what is called as unintentional adulteration. But definitely in some cases adulteration is intentional as well to get more cost benefits. So as the raw material reaches me, I can definitely do a quality control, but if the adulteration is there, it becomes difficult for me to formulate. Why? Because more the adulteration, the content of my active decreases. So I will have to increase the dose of my formulation in order to match the active or to standardize the active. Not only that, the plant that I purchase or the raw material that I purchase from different geographical locations have a good variation. So if you purchase something from southern India like your cinnamon versus your cinnamon that is cultivated in Maharashtra, you will see that there is a good difference between oil content. Now this percentage oil content may vary, the percentage bioactive ingredient may vary, or in some cases there are some compounds which might be completely missing from one geographical species. So hence quality control and standardization here is very important. Not only that, you will see that there is also a seasonal variation. So during some seasons, especially your summer seasons, you will see the tannin content and volatile oil content higher, whereas during rainy season the moisture content is higher. So you need to take a good gauge of which season is good for harvesting and best prepare your extracts in that particular season. Once collected, the herb, like I said, is prone to deterioration, and that is not clearly seen in allopathic. But in herbal, whenever deterioration happens, you can take an example of a kokum juice. So you prepare a fresh kokum juice from your Garcinia fruit, and the moment you prepare your kokum juice or your beetroot juice, they are all nice pink in color due to presence of anthocyanins. Just keep it for a day at room temperature. The next day the pink color deteriorates to brown. Same happens with your herbal preparations. So most of the allopathic preparation, your white tablet will still remain white, whereas in herbal preparation your initial green tablet might over a period of time brown or even blacken depending upon the nature of ingredients present in it. So there is a change in color, change in viscosity, change in texture in cases of drugs that imbibe moisture, and that is a big problem for herbal formulators, especially if you are thinking of a shelf like a year or two. The moisture content won't let that drug stay stable for a year and two, and that's how you to control it and prevent deterioration by adding certain suitable ingredients, in some cases chelating agents, in some cases antioxidants, preservatives, or combination of all of them. Not only that, you will see that in many formulations at the rim you will see infestations by fungus, molds, insects, or even worms if the preservative content goes below the desired level. So, most of your herbal formulations do require preservatives apart from your herbal syrups, and because these preservatives are, in some cases undesired, people want to substitute it most of the natural ingredients. But still, I mean, in some cases many of these natural ingredients are not broad spectrum preservatives, so there is a good chance of infestation by bacteria, by fungus, by other parasites, or even sometimes insects, and that needs to be controlled if I have to have a very good quality herbal formulation. Now, for the herbal formulations, once I have decided how do I prepare the extracts and concentrates, the preparation of extracts and concentrates is very vital. So, in the first thing, suppose if I want to prepare a tablet or a chawanprash or a capsule, I have to select the herb. Now, this herb depends upon my end product. Say for example, if it is a Brahmi based hair oil, or a Brahmi Amla hair oil. In that case, my herbs are going to be Brahmi, Amla, and your coconut oil. So, I am going to shortlist what all herbs I require. I am going to ensure that a good quality raw material reaches me. I am going to do quality control of that material and check whether this is stable over a period of time. Now, once this is taken, I decrease the moisture content of that preparation by drying. Now, depending upon which set of compounds are present in this plant, the drying may be done at elevated temperatures in tray dryers, or they may be done at room temperatures. In some cases, even vacuum drying, spray drying, or freeze drying is done. So, in case of drying of herbs, depending upon the consistency, in herbs we have organized drugs or unorganized drugs. So, most of the organized drugs are done by tray drying or even vacuum drying. But when it comes to unorganized drugs like juices, extracts, in that case it is good to even spray dry or freeze dry. Once you have the dried herbs or drugs, you can size reduce it, because finer the size, better will be the bioavailability of your active. So, size reduction will ensure a good bioavailability, it will ensure a good powder flow and consistency, so that lumpiness, grittiness, that texture is not felt when you are consuming it or when you are using it. So, size reduction is done, then subsequent extraction using suitable solvents. Now, in some herbs where you consume the herb as such, like your shatavari, ashwagandha, after size reduction it is directly packed in the bottle. But in some cases like your chawanprash or your creams, where you want the actives only, you don't want the cellulosic matter, you don't want the plant debris, in that case the bioactives are extracted with a suitable solvent. Now, this solvent is chosen on the basis of like dissolves like. So, if I want a polar compound like tannins coming out, I will use water. But if I want my non-polar compounds like your carotenoids coming in that case I will use something lipophilic or oily. Like your turmeric, most often your oily base is preferred because curcumin is more oil soluble. Whereas for tannins, polyphenols, your water or hydroalcoholic solvents are preferred. Now, once extracted, the next thing is you cannot consume alcohol based, or you cannot consume oils or solvents that are there or which were used for extraction. So, next step is to remove those solvents completely, and this is done by concentration. So, this concentration kind of distills or evaporates or removes the solvent, and then you have your dried extracts or concentrates which are ready to be incorporated in your final preparations. This includes your creams, gels, films, etc. So when you're doing this, there are few things you to consider at every step. First is, what is going to be the dose of my bioactive ingredient. Say for example, if the dose is going to be like 50 milligram, how much amount of extract is going to deliver me 50 milligram. So that is something I'll keep it in mind. I can also modify my extraction to enhance the bioavailability. So in some cases what happens is the presence of lipid hinder the bioavailability of others. So imagine you have a very oleaginous drug like your seeds. Seeds are often laced with oils. So they hinder water from entering in. So what I should do is I should prepare my extracts and concentrate in a way that I have a more bioavailable form. Now this is also done in Ayurveda, where they used to disperse your drugs in ghee or even milk in order to enhance its bioavailability. A good way of saying that is, when you disperse your turmeric in your milk, you are using a solvent which enhances the bioavailability of curcumin for your system. Next thing is, when I concentrate or extract, I should take care that my compound should not deteriorate over a period of time. So this includes your thermal and pH stability. So I should not go at temperatures where my compounds are unstable. I should not move to extremes of pH where my acids or bases might deteriorate. Not only that, I should see the solubility. Like I said, your general empirical rule is like dissolves like. So if I want polar, I will extract it with polar. I cannot prepare a water-based kadha for a lipophilic drug and then expect that water-based kadha to get you the desired therapeutic effect. So say for example, I want curcumin. We said curcumin is dispersed in milk because your curcumin is oil soluble. Imagine if you're boiling your haldi in water, you will get curcumin, but you will get in a very smaller concentration. So solubility of my bioactive, the knowledge of it is very vital. Next thing is moisture content. Even after the extracts and concentrates are prepared, you have to see that the moisture content is low to prevent deterioration. And last consideration is, if it is a polyherbal formulation, you can do extraction together in some cases where it is not inhibitory in terms of its activity. So I can mix Triphala Churna, I can use all the 3 herbs, or I can take Dashmula Arishta, I can take all the 10 roots, boil it together and prepare an arishta out of it, rather than extracting individual herbs and then preparing a mixture of it. So these are few considerations for your herbal preparations, and from next session onwards we'll start with the actual examples of herbal preparations. So here are few references which might help you to gain some knowledge into herbal preparations, and thank you everyone for your patient listening.